I'm particularly excited as an internist and pediatrician about the expansions that we're doing in the Better Health Partnership into pediatrics. I think just to quickly frame this, I would say that the pediatric obesity is the most common chronic disease in children, so huge and extremely underdiagnosed. I've been doing my own research in pediatric hypertension and obesity for almost a decade now, and the majority of children that have a weight problem, it's not recognized either by the healthcare team taking care of them or by the patient or the family that they're in. And it's a similar type of story for pediatric hypertension, where again we've done significant studies, even national studies, that show that the majority of pediatric hypertension is not diagnosed. Probably only about 25% of it's diagnosed, and even among the patients where it's diagnosed, in general, only about 10 or maybe 20% is it appropriately managed. So these are really huge opportunities. So that's putting on my hat sort of as a pediatrician researcher. Now putting on my hat as an informaticist, this data is awesome. I mean, I do not, what I mean by that is, I am not aware of any other study that's ever been published or any other community where you can look at a map and literally look at a population, of upwards of 200,000 children from multiple healthcare systems, looking at all their data together, geographically mapped. I mean, that's just incredible. But then I also think it presents a real opportunity for us. One of the things I say as sort of a data scientist is we have data, information, knowledge, and wisdom. And I would say what we have here, we've gotten a lot of data from all of our healthcare systems, and then Tom and his team have sort of put that together to information, but what is the knowledge and wisdom? So again, I think the real opportunity for me as an internist and pediatrician is, I know a lot about diabetes and hypertension in adults, and obviously Better Health Partnership has shown how hugely able to change the care that's being provided with the help of all of us. And so now we know obesity and hypertension in children, usually when it's very asymptomatic, that's going to lead to diabetes, hypertension, even congestive heart failure in adults. So I think the real opportunity for us now over the next decade of Better Health Partnership is, how can we take this information that we have now about pediatric hypertension, obesity, and then try to get that knowledge and wisdom so we can close any disparity gaps or even those opportunities for diagnosis and improved care. So the idea here is not only could we decrease the prevalence of those diseases, but actually instead of having to take care of those diabetic, hypertensive, obese patients as adults, actually eliminate or decrease the prevalence of those diseases into adulthood. So I think the data is amazing and awesome to help us show what the potential path is, but now the challenge is really all of ours to really try to figure out what we need to do with that to help the care of people in Cleveland. And I think Better Health Partnership has a great track record of doing that for other diseases. So I'm very excited in continuing to work in partnership and very optimistic about what we'll be able to do in this area in the coming decade.